Bismillahirrahmanirrahim. My name is Dr. Ambarashad, and today my topic of presentation is Trichomoniasis under supervision of Professor Dr. Saira Afzal. In this presentation, there would be a brief introduction, then the epidemiological factors, chain of transmission, clinical manifestations, and the levels of prevention and how the diseases, the natural history of the disease corresponds to the levels of the prevention and recent advances. At the end of the presentation, the participants will be able to describe the epidemiological aspects with preventive aspects of trichomoniasis and some global and national updates as well. Trichomoniasis, as we know, it's a common sexually transmitted disease and it's caused by a protozoan parasite that is Trichomonas vaginalis. Initially, comparison to chlamydia and other STIs, the prevalence rate of this disease or infection is highest among the age group of women 15 to 25 years of age. It is highly prevalent in developed countries as well as in developing countries. In Pakistan, recently I was studying an article that showed that almost 5% of the sexual workers were reported Trichomonas vaginalis infection. And I will share that article in the group as well. So it is an infection that is present in our society as well and mostly affects the women of this age group. And this infection is asymptomatic, mostly in women, but 70 to 80% in men as well. And this infection in pregnancy would cause some adverse outcomes that can affect the newborn baby, unborn baby, or a infant. So the sector strategy on sexually transmitted infections, and it was from 2016-2021. And this strategy had a rapid upscale of evidence-based interventions and to provide service and to end sexually transmitted diseases by the end of 2030. So the objective was to estimate global prevalence of the study of chlamydia and other infections. This was a case that was an 18-year-old girl who presented to her pediatrician with her mother for her pre-college checkup, and she has no past medical history. And after her mother leaves the room for the social history component, the girl admits to have an intercourse with a partner and complains of yellow-greenish melodrous vaginal discharge. She endorses mild pelvic pain and cervix is pink, nulliparous inflamed, and is covered in small red punctate spots. A wet prep is made and reveals squamous cells and numerous motile organisms. So this was a typical presentation of how a woman or a girl can present with the Trichomonas vaginalis infection, and the cervix has a typical representation with tenderness and mild pelvic pain. So this is the epidemiologic triad. Coming up to the agent, I've already told it is a protozoan and it is a Trichomonas vaginalis and it is a motile organism. And the host factors include that the people with more sexual partners like the sex workers and all that have these infections on frequently. And other risk factors includes limited education and low socioeconomic status, hygiene, etc. And Trichomonas vaginalis infection is encountered in every continent, in every climate, and there is no seasonal variability for that. And Trichomonas vaginalis, mostly the trophozoites lives in vagina, urethra of the female and urethra in the male and goes up to the may cause prostate infections. There is, since it is a sexually transmitted disease, so extensive literature have showed that non-sexual transmission of trichomonas can also occur through fomites, that is towels and toilet seats and swimming pools. So whole of this infection can be transmitted through various, there is other hosts other than humans, and fomites are also the cause of the transmission. So, trophozoites can survive outside and can also be the cause of infection that is directly transmitted from person to person. So, so babies get infected from the fomites during birth, and the incubation period is roughly 10 days. But the average is from 5 to 28 days, and the symptoms comes and goes, and mostly it's mild. As you can see that as compared to other infections, the range is between 5 to 28 days, and it is only for women. That can vary for men as well. So this is the cervix, typical presentation of the strawberry cervix, and in women. And in men, the infections are frequently asymptomatic with a discharge in dysuria, nocturia, and enlarged tender prostate and epididymitis. So 70% of the infections does not have any signs and symptoms and can range from mild irritations to severe inflammations within 5 to 28 days of infection. So a small difference between male and female. The female have a yellowish greenish discharge with a vaginal bleed, genital burning, and a frequent urge to urinate, whereas in males there is discharge from urethra if there are symptoms, burning during urination, ejaculation, and urge to urinate frequently as well. There are some complications, and for example, trichomoniasis genital infections make it easier to get infected with HIV and to pass HIV virus onto the sexual partner. So pregnant women are likely to have their babies too early, preterm, and also babies born to infected mothers are more likely to have low birth weights, less than 5.5 pounds. So as you can see that the level of preventions start here. This is the hierarchy of the levels of prevention. So we'll start with the general prevention and control includes safe sex behavior, avoid multiple sexual partners, and use of barrier methods and detection and treatment of cases, either males and females, with the diagnostic tests. So this is like use, get, be, limit, and don't and do not abuse. So use condoms, get it tested, be have single partners, and limit your number of sexual partners, and do not abuse alcohol and drugs. So from the primary prevention point of view, the health education point of view was covered in the previous slides, but coming to the specific protection, currently no registered vaccine is available for human use, but this one vaccine is used in developed countries and is generally directed as to administer to the for the animal use only. And it's administered 2 ml dose simultaneously to the neck, and then for the second dose 2 to 4 weeks later on. And an annual booster uh, breeding season by not less than 4 weeks. And no specific human vaccine has been developed yet. So in secondary prevention, there is early diagnosis and prompt treatment. For the diagnosis, trichomoniasis based on symptoms alone is not possible. For both men and women, there must be some other laboratory test to be tested. So microscopy, culture, antigen detection, molecular diagnosis, and other tests are available for its diagnosis. In women, the specimen is taken by the vaginal discharge and endocervical specimens, and in men, the prostate fluid. And commonly, like these swabs are taken. Microscopy is done by wet mount and pap smear and direct fluorescent antibody testing. Culture is gold standard for the diagnosis of this disease. And trichomoniasis can be treated with medication like metronidazoles. Pills are taken orally, and it's recommended not to take alcohol within 24 hours. So the recommended dose is that to avoid getting reinfection, all sexual partners must be treated with the same antibiotic and get checked at every 3 months. So this is an article that shows that diagnosis and management of Trichomonas vaginalis, showing the CDC summary evidence reviewed by CDC. And it shows that newly available diagnostic techniques including point-of-care assay and multi-nucleic acid amplification tests are available in most developed countries, that is performed on specimens like urine and allowing accurate and convenient testing. Repeat and persistent infections are common in women, thus rescreening at 3 months after treatment is recommended. So the next is that in vitro antibiotic resistance to 5-nitromerazole is low, so it should be monitored. And oral, actually, there is high rates of it a randomized controlled trial in an HIV uninfected women demonstrated that multi-dose metronidazole 500 milligram twice daily for 7 days reduces the proportion of women with this infection. So, 2 gram single dose oral metronidazole regime remains the preferred treatment in men as well. So, some of the recent advances. This was a paper showed that Trichomonas vaginalis and growing concern over drug resistance, a systematic review. And as we know that the main treatment against the disease is metronidazole and some other nitromedazole's derivatives. However, between 5 to 20% of the clinical cases are caused by these parasite resistance. So what to be done in this case? So for this, some other drugs have been established, but still the standard treatment is this mostly it is metronidazole. And this review reveals that they need to standardize the susceptibility testing to define breakpoints for detection of this resistance strains, and important to establish a criteria to define clinical resistance to metronidazoles and treatment suggested accordingly. So, novel treatment approaches to combat Trichomonas vaginalis as a neglected and sexually transmitted infection. So, although related to the curable STIs, the current drugs, metronidazoles, tenidazoles, and present therapeutic failures are there. So, the need for the new option to treat Trichomonas is established by basic studies, and clinical trials are still focused on new routes for administration of the conventional drugs. So, in addition to nanotechnology approaches, are in their infancies, shedding light on potential possibilities of creating more effective and targeted and safe delivery systems is the focus of the researchers nowadays. So now coming to the MCQs. In a 28-year-old African American woman comes into the STI clinic with her partner to get an HIV test, to get screened for the STIs. And she has a history of these STIs in the past. So the routine screening ordered for this woman includes screening of Trichomonas vaginalis infection. Which one of the following would you recommend as a preferred screening test for this asymptomatic women? Either it's wet mount, it's NAT test, it's a culture for first catch urine, culture for midstream urine, or a PCR.
B.
Yes, B is the right answer. Vaginal swab specimen would be the preferred test for this women in this scenario. A 39-year-old woman presents in a clinic with 5-day history of abnormally increased and slightly malodorous discharge. With dysuria, polyuria, and she has been sexually active. The point of care testing by HIV and pregnancy are negative. Evaluation of bacterial vaginosis yielded only an abnormally elevated pH level. Swabs are sent and are negative for chlamydia trachomitis, but positive for Trichomonas vaginalis. Which of the following is the best regime for the treatment of such women? Metronidazole 2 gram orally in a single dose. Metronidazole 500 milligrams twice a day for 10 days. Metronidazole, nitroxenamide. Nitax, what is it? I don't know. Metronidazole gel intravaginally or metronidazole 2 gram orally in a 2 dose. So, what is the preferred treatment?
B.
Actually, in this case, it represents a typical case with a positive Trichomonas vaginalis in the swab. So, A is the right option. Metronidazole 2 grams orally in a single dose would be sufficient for this woman. A 25-year-old woman recently diagnosed with HIV. on her initial visit and she acquired HIV through an unprotected intercourse. So she's feeling well and without specific complaints. As a part of her visit, you are planning to do a routine screening for sexually transmitted infection. Which of the following is true regarding trichomonas infection in women with HIV? Trichomonas screening is not recommended in women with HIV having the low prevalence rates, lower vaginal and endocervical HIV RNase levels. An increased incidence of pelvic inflammatory infections and genital is enhanced and have an enhanced HIV shedding. Recommended treatment of trichomonas is the same in women as with HIV, reduced HIV genital tract shedding.
C.
B.
C.
The answer comes up to be C. An increased incidence of pelvic inflammatory diseases with increased genital tract and enhanced HIV shedding. Because when the person is having an HIV, then the treatments are different, symptoms are different, the susceptibility to getting the other STIs is also there. So there are chances that the symptoms would be enhanced and have more severe symptoms rather than HIV negative women. A 19-year-old man returns home after first semester of college. While away, he had two different sexual partners and is anxious for having a screening for an STI. A plan is made to perform testing for chlamydia, trichomonas, and gonorrhea. And he mentioned that he has read about trichomonas on internet and asks whether he should be tested for this as well or not. Which one of the following would you recommend regarding testing of this man for Trichomonas vaginalis? A urethral swab for culture, a urine sample, NAT testing. Do not offer testing and there is no clear benefit in screening an asymptomatic man for Trichomonas, and microscopic sampling.
A. C.
And
C.
we know that this is a very this infection is very uncommon in men, but it occurs, and mostly it is asymptomatic, and it's not without any and normally the screening is not recommended in males. But if they are having symptoms, then treatment is required and also sampling. So since there are no symptoms and he's only anxious about having the STIs, so it's better not to offer any testing as there is no clear benefit of screening an asymptomatic man for such infection. So D is the right answer. What species of protozoas causes a foul smelling vaginal discharge with itching and burning? And on physical examination, a fiery red cervix. I think it's very obvious.
C.
Yes, it
C.
is C. And the purpose of giving this simple MCQ is sometimes we go into the details of very minor details and we forget the typical representation on the examination. That is the most that is the first step after history taking, and mostly we ignore the findings and the terms skip out from our mind. So this giving this simple MCQ was just to reinforce on the concept of this fairy red cervix. So this behind this. So a young woman goes to a doctor with a variety of medical complaints and her mucosa surfaces are tender, inflamed, eroded and covered with yellow discharge. For one problem, the laboratory reports the isolation has a pear-shaped protozoan with a whip-like motility and the organisms is observed in which of the following? Biopsied muscles, blood, duodenal, sputum or vaginal secretions.
E.
Yes, it's vaginal secretion. Mostly it will be seen in the vaginal secretions. So it's better to take a swab for this vaginal secretions and go for the NAT testing. A 25-year-old woman at 20 weeks of gestation is told that her infection can cause preterm birth, but has a little effect on the baby. What is a single most likely organism responsible for such clinical characteristics described? With little effect on the baby, but can have a preterm birth. So there is a risk.
E.
Yes, according to the topic, yes, E is the right answer. So having very little side effects on the baby, but there are chances of preterms at 20 weeks, then it's trichomonas. Which statement about this specific organism is true? It is a sexually transmitted disease caused by a protozoan. It's usually incurable. Men often show symptoms. Contacts with contaminated dry surfaces can lead. Contact with contaminated dry surfaces can lead to the infections. And pregnant women infected with trichomonas often have spontaneous abortions.
A.
Yes, A is
Alpha.
the right answer. You can get distracted by D and E. Spontaneous abortions are not the part of this whole vertical transmission and the process. It only causes preterm births. No damage is done to the fetus. And secondly, contact with contaminated dry surfaces cannot lead to the infections. Um, Mostly, it is through the person to person transmission, the most common transmission mode. But fomites are causes, but this can be misleading option. A young woman presents to the genitourinary clinic after vaginal swabs. The posterior fornix, the microscope reveals Trichomonas vaginalis. And the Trichomonas is transmitted by which stage? I think I have not explained this in my. So, if any guesses, skip that part.
Delta.
It's a topozoid. I skipped the cycle, but for general discussion, it's a trophozoite in which stage the trichomonas is transmitted. And a 63-year-old woman is evaluated for 3 weeks history of vaginal discharge. The discharge is described as yellowish, melodious, and accompanied by burning and other symptoms with the positive testing. Treatment with a single dose metronidazole is planned. Which of the following is the most appropriate additional intervention? Confirm infection with a NAT amplification test. Perform a repeat pap smear test for cure. Following treatment, treat the patient's sexual partners, counsel the patient, and send her home. Additional. I'm talking about the additional treatment. Any guesses?
E.
Yes, it's D. Treat the sexual partner as well, and a woman or a person reports to a clinic. So this is the key. So this is the YouTube link, and thank you so much. Any questions?
Thank you so much,
Thank
Dr.
you so
Amrullah.
much. Thank you so much, Dr. Sadi. Allah Hafiz.